Graves' disease is an autoimmune disease that is the most common cause of hyperthyroidism. Hyperthyroidism is a disorder where the thyroid gland enlarges and overproduces thyroid hormones. The thyroid gland is in the neck and in front of the trachea. It is regulated by the pituitary gland and uses iodine to produce hormones. These hormones regulate growth, development, metabolism, and body temperature. Graves' disease also causes symptoms of weight loss, rapid heart rate, higher blood pressure, a feeling of warmth in the body, hand tremors, more frequent bowel movements, and the development of a goiter, which is a visible enlargement of the thyroid gland. In women, Graves' disease can disrupt their cycle of menstrual periods. A small percentage of those who suffer from Graves' disease report symptoms of bulging eyes. This is a condition known as Graves' ophthalmopathy or Graves' eye disease. In the most rare cases, some patients also develop thickened, lumped skin in front of the shins. Graves' disease is quite common and affects 1 in 200 people. Women are more likely to get Graves' disease, almost 5 to 10 times more likely than men. The symptoms of Graves' disease tend to affect women after the age of 20, and many women after pregnancy develop Graves' disease. The true reason why the thyroid gland overproduces hormones is unknown. However, this condition is linked to high levels of TSH, or thyroid-stimulating hormones, produced by the pituitary gland. If left untreated, Graves' disease can lead to the development of cancer in the thyroid. Luckily, there are many options for treatment. Radioactive iodine medication is a one-time treatment for hyperthyroidism. This treatment is effective because, as stated earlier, the thyroid gland uses iodine to function. When the radioactive iodine is absorbed by thyroid cells, the thyroid cells are destroyed and will gradually secrete less hormones. Radioactive iodine will not affect surrounding organs or tissues because thyroid cells are the main cells that absorb iodine. However, this treatment cannot be given to pregnant women as the radioactive iodine will also be absorbed by the baby's thyroid. Another treatment is anti-thyroid drugs. Anti-thyroid drugs like methimazole inhibit thyroid hormone production. These pills are usually taken once a day for several months until symptoms subside. Your physician may recommend you continue to take anti-thyroid drugs for a few months even after your symptoms go away to ensure your thyroid is working properly. This, in combination with diet and exercise changes, can permanently drop your thyroid hormone levels. The last treatment for Graves' disease is subtotal thyroidectomy. This procedure will result in most of the thyroid gland being removed. It is a relatively safe operation with a high rate of success. This is my sister Mary. She enjoys baking and long walks on the beach. On January 19th, my sister was diagnosed with Graves' disease. I sat down with Mary to ask her about her diagnosis and how I could help.
I, for a few months, had noticed that I had irregular periods, and then all my life I was really warm. I had a slight tremor in my hands, I had slightly bulging eyes, stress, and a rapid heartbeat. Okay, so I went in for my annual checkup with my physician, and I told her that I had my irregular periods, and so she suggested that I get my thyroid levels tested. And then from there, her and my endocrinologist found out that I had hyperthyroidism, and I was then diagnosed with Graves' disease. My physician prescribed medication for me to prevent my body from overproducing thyroid hormones. My physician also recommended that I make a couple of lifestyle changes that include a slightly healthier diet and more physical activity. Because Graves' disease is an autoimmune disease, I'm more likely to get complications were I to contract the coronavirus, so I've been self-quarantining in my house and not even going out for some things such as grocery shopping or daily walks. This has made it more difficult for me to get a good amount of physical activity every day. Lack of physical activity conflicts with my doctor's orders to get more physical activity. James has volunteered to form a diet plan and a physical activity plan for me that allows me to stay quarantined.
Luckily, my sister was diagnosed with Graves' disease much earlier than usual. Because of this, her physician concluded she would not need surgery to remove a portion of her thyroid gland. Instead, she opted for the medication and lifestyle changes treatment plan. Our family has a history of thyroid complications. Both my grandfather and aunt on my mom's side were diagnosed with hyperthyroidism. For my service project, I developed a balanced, flexible diet and exercise plan. The diet plan was focused on avoiding high iodine foods, specifically seafood, egg yolks, cheese, and milk. I also added foods that were high in calcium, vitamin D, zinc, and iron to our diet. The exercise plan I created centered around fun, healthy exercises. I wanted to have unique exercises each day so our workout would not feel monotonous. These exercises are not necessarily strenuous because I wanted my sister to stay motivated. In combination with her medications, I believe this plan will help my sister recover from Graves' disease and motivate her to live a healthy life.